Hi, my name is Dave Hodge.
And I'm Catherine Hodge, and this is our little girl, Charlotte Hodge. We are headed to Lilongwe, the capital of Malawi, on May 1st of 2014.
We are going with In His Image International, a small missionary sending agency associated with Catherine's Medical Residency Training Program.
Malawi is the highlighted country in Southeast Africa. Malawi is the size of Pennsylvania and has 16 million people. There are less than 400 doctors, so there's about one doctor per 30,000 people. Florida also has 16 million people, but there are 44,000 doctors in Florida. In fact, only 10% of Malawans even have electricity. Christianity makes up about 80% of the country's religion, and Islam is the other 20%. However, in general, the Christian faith is practiced very nominally and in conjunction with animism and witchcraft. We first heard about Malawi after we met Chisu and Uni Choi. Chisu is an internal medicine physician in Tulsa, Oklahoma, where I trained. He and Uni are moving to Lilongwe to work at a hospital called Dying Luke Hospital, and they have asked us to join their team.
As you can see, Lilongwe is located at the center of the country. Although it is the capital, it is very rural, with 1 million people spread across the city. Our hospital is located on the outskirts of the city.
Malaria is a very deadly disease in Malawi. Our hospital has about 100 beds, and during malaria season, there are about 3 kids to a bed. The prevalence of HIV puts Malawi at number 9 out of all countries, and the deadliness of maternal mortality is number 7. This has produced 1 million orphans in Malawi, which is 1/16 of their population. In this picture, you can see Mr. Chung in the middle of the orphans. He is the founding donor of the Dying Luke Hospital, and he actually continues to support the hospital financially even now.
This is the front of Dying Luke Hospital. This is an aerial view of the hospital. In the middle, the upper right shows the church, and the nursing college is located in the upper left. The hospital is a beautiful facility with improving medical equipment, including a CT scanner. It is lacking staff, so we are hoping to fill some of those needs. You can see a beautiful waterfall and verses that adorn the walls of the waiting room. We will be living in the missionary duplex located in the upper left hand of this picture. It is just a few minutes walk away from the hospital. The picture of the house shows the front of the duplex, of which we will live in half of.
Dave and I went to Malawi for a month in 2011, so I could get a feel for what it would be like to work at the hospital. At that time, we, along with several others, met with the Ministry of Health and asked for their approval on starting a family medicine training program for Malawi, since they have none. Currently, most of the medical school graduates leave for further training and don't come back, or they start their practices without any residency training at all. We are very excited that the Ministry of Health approved our request, and we plan to start the first residency training program at our hospital in fall of next year. Another thing that we are very excited about is the chance to disciple young Christians. There is a nursing college on campus with 90 nursing students, many of whom are passionate for the Lord but have not had any mentorship or chance for serious Bible study. Dave and I both plan to take a handful of these students and mentor them throughout our years there.
The compound has a community church with 200 local villagers who attend, so we're excited to make that our home church as well. The picture shows our compound on the bottom left, and immediately to the right is the village of attendees. In addition to mentoring the nursing students, I plan to spend my time volunteering at the local church and village school, although those opportunities will be more clear once we are there.
Our team will be led by Chisu and Uni Choi, Missionary Beck, the nurse who started Dying Luke Hospital with Mr. Chung's help, Dr. Susie Kim, a Korean nurse who runs the nursing college, Dr. Kim, a Korean infectious disease specialist, and his family, Dr. Sue Macon, an OB-GYN from the University of Florida who has been a missionary for many years, and not pictured is Dr. Lee and his family, a Korean surgeon who will be joining us. Dr. Podgore and his wife will also be joining us. He is a pediatric infectious disease specialist who comes each year from Texas just for malaria season. And that about wraps up our picture set. Thank you for listening, and please let us know of any questions that you have.